Let us see the scapulo-humeral spaces. The spaces which is present around the scapula, it is now also known as the intermuscular spaces. So we will study the spaces of only one side, which is the right side of the space. Just to remember, usually everyone teaches you like this, right? Like this. So let me draw this diagram just to make you understand, right? So scapulo-humeral spaces of the right side. So suppose this is our humerus. Okay, this is the long head of triceps. Okay, this one is the teres minor muscle, and this is the teres major muscle, right? Now let us draw this diagram little bit correctly. You should not draw this diagram for your exam purpose, right? You should not draw it for your exam. So scapulo-humeral space of the right side, this is the humerus. This is the head of your humerus. Okay, this one is the head. This is the neck of the humerus. Here this muscle is the long head of the triceps, which arises from the infraglenoid tubercle. Okay, this is the teres minor muscle inserted on the humerus, just on the upper impression. This is the teres major muscle. There is a little bit gap between these two muscles, teres minor, and there is teres major muscle. So basically there are three spaces formed by these three muscles: teres minor, teres major, and triceps, long head of the triceps. And the humerus also take part in the formation of the intermuscular spaces. So all the muscles begin from the T. So you can remember teres minor, teres major, and triceps, the long head, and with the humerus. These four structures take part in the formation of the intermuscular spaces. There are three spaces are there. This space is known as the quadrangular space. So this space is known as the quadrangular space. This space is known as the lower triangular space. Okay, and this space, this is known as the, we can see this is the upper triangular space. So this is quadrangular, this is lower triangular, and this one is the upper quadrangular space. Now you can see the boundaries of quadrangular space. As it is quadrangular in space, it is bounded above by lower border of teres minor, below by upper border of teres major. On the medial side, it is bounded by the neck of the humerus. On the lateral side, it is bounded by the medial border of the triceps, long head of the triceps, right? Now lower triangular boundaries. Above it is bounded by lower border of teres major. On the medial side, okay, on the medial side it is bounded by the shaft of the humerus. On the lateral side it is bounded by the medial border of the triceps. Upper triangular space boundaries. Above it is bounded by lower border of teres minor, below bounded by upper border of teres major, and on the medial side it is bounded by the lateral border of the long head of the triceps. So it is visible and you can easily identify its boundaries, right? Now structures present within this spaces. First, quadrangular space. You can see here there is the neck of the humerus is there, and the neck of the humerus, it is related with the axillary nerve. This neck of the humerus, it is also related with the circumflex humeral artery, which is a branch of third part of axillary artery. So the contents of quadrangular space is axillary nerve, and as it lies on the posterior side, there will be the posterior circumflex humeral artery. Two structures are there in quadrangular space. Now here you can see this is the humerus, and on the posterior side on the humerus there will be the presence of radial groove, and structure passing from the radial groove is radial nerve itself, right? And just below it there will be the one of the largest branch of brachial artery, which is a profunda brachial artery. So in the lower triangular space the contents are radial nerve and profunda brachial artery. Now similarly on this upper triangular space having only one structure which wind around the scapula. So it consists of the circumflex scapular artery. So contents of upper quadrangular space is circumflex scapular artery. So this is a simple topic, and they usually ask in your theory questions. So this is simply, you can remember three spaces: intermuscular spaces, also known as the scapulo-humeral spaces. Thank you. If you like my videos, please subscribe this channel and hit the like button.